Okay, so this is a ortho class, okay, regarding model analysis. Today's topic is about model analysis, okay. So can everybody able to hear me? Is it nice and clear, audible, right? Yes, okay. Can you able to see the PowerPoint? Yes, okay, very good. Now you can mute your audio, okay? Now everyone mute your audio. So almost 62 participants have been added. So I am starting the class now, okay? So in meantime I will check and I will add someone if they are waiting, okay? So today's class is about model analysis. As you people know, the diagnostic aids, we are talking about orthodontic diagnosis, case histories and extraoral diagnosis, intraoral diagnosis, and then diagnostic aids, x-rays and model analysis. What is the importance of the model, pouring cast. When the patient comes, you are doing orthodontic diagnosis. You are starting from the case history and we are doing all the details. We are noting down, and you are checking the patient, examining the patient intraorally, extraorally, and then you are noting all the case histories and chief complaints, right? So later comes the part is when you finish the intraoral diagnosis, you do as a diagnostic aid. Certain diagnostic aids are important to come into a final diagnosis, right? So we are taking x-rays and we are taking the impression for the patient, and then duplicating the impression, like duplicating their oral cavity or tooth structure or maxilla and mandible. So that is nothing but your cast or dental model, okay. So with the dental model, then you are using certain analysis. You are doing some analysis in the model, and then there are certain analysis which is given by people in the orthodontics. So they have derived an analysis. They have derived certain formulas. They have derived certain calculations to come to a conclusion regarding the model analysis, to rule out certain discrepancy, to find out certain diagnosis, to find out certain malocclusion, to find out certain discrepancy in the patient oral cavity or teeth alignment or any malocclusion. This model analysis also is useful, right? The model analysis is very important, very important essential diagnosis to come to a conclusion for final diagnosis, and as well as to derive a proper treatment plan, to give a proper treatment suggestion to the patient, and then whether the patient is going for a fixed appliance, whether the patient need extraction, or whether the patient need functional appliance. So regarding these kind of things, certain essential diagnoses are important. In that, model analysis are very important, okay. So model analysis is nothing but, the definition of model analysis is the study of dental cast, which helps to study the occlusion and dentition from all the three dimensions, transverse, vertical and longitudinal dimensions, okay. So all three dimensions we can study. That is a very important aspect of the dental cast, because in the oral cavity we cannot be able to see all the three-dimensional view. Only for frontal view only we can able to establish, and the side view only we can able to establish. But when we are having dental cast of the patient, we can examine the lingual aspect of the patient as well, and the palatal aspect of the patient, and the back view also you can establish. So coming to the model analysis, all the three dimensions and analyze the degree and severity of the malocclusion. As I told you, the degree and severity of the malocclusion can be analyzed and to derive a proper diagnosis and treatment plan. Okay. So the requirements to do this, to do the model analysis, to do certain analysis in the cast, you need certain requirements or tools for doing the model analysis. Those are the study models of the particular patient who you want to get analysis. Okay, so the particular study models, and then vernier caliper, divider, yes, vernier caliper, divider, ruler, and then brass wire. Ruler is nothing but scale, metal scale or any scale. Okay, so these are the requirements need to do for to do the model analysis, right? So next thing is classification of the model analysis. There are you can classify certain models. There are very simple 4 to 5 model analysis only, which we are doing in your orthodontic department, are very essential for model analysis or for diagnostic. So you can also classify the model analysis based on certain criteria. We can classify the model analysis, classification of model analysis. Okay, based on the permanent or mixed dentition, we can classify, and then based on maxilla or mandible. If the model analysis is carried out on maxilla, it is classified in a certain way. It is carried out in the mandible, so it is come under different classification. So likewise, based on the maxilla and mandible, we can classify, and then based on the permanent and mixed dentition, we can classify. Okay, and then based on the tooth supporting and then supporting structure, if the model analysis is confined to along only the tooth structure, you can classify into separate group, and then if the model analysis involving the supporting structure, then you can classify it in another subgroups. Okay, so that is the classification. Okay, so in the permanent dentition patient, after the mixed dentition or vested dentition has been over, the patient came into a permanent dentition around 15 to 16 years of age. So that time we can do certain analysis, caries analysis, arch perimeter analysis, Ashley-Wolf's analysis, and then Bolton's analysis. In orthodontics, most of the patients will come to a treatment around above 16 to 18 years of age, right? So we are advising fixed appliance for the patient. So in certain patients, in certain permanent dentition patient, in the patient above 14 to 16 years of age, we are doing certain analysis, nothing but caries, arch perimeter, and then Ashley-Wolf's analysis, and then Bolton's analysis. Okay, so in to rule out certain space discrepancy, arch length, which will see later on the later slide of the under each analysis. Okay, so in mixed dentition time, in the mixed dentition period, that time also we are doing certain analysis, nothing but Moyer's mixed dentition analysis, and then Tanaka-Johnson method or mixed dentition analysis. Okay, so this is also useful in calculating certain discrepancies, certain values. So in the mixed dentition period, what is the eruption, how the permanent erupt, how much space is required for the eruption of the permanent teeth. So these calculations can be made in the mixed dentition analysis. Okay, so next now we are seeing about caries analysis. So first thing is the caries analysis. Caries analysis is nothing but the arch length, the length of the arch, and then the tooth material, each and every tooth, how much space or how much how much material of the tooth is required to fill the arch length. So that is evaluated in the caries analysis. So in the caries analysis, there is arch length, tooth material discrepancy is calculated, and then discrepancy is calculated. So that is the main cause of the malocclusion. So if the arch length is larger, okay, if the arch length is larger and then the tooth material, the size of the tooth is smaller, then that will cause certain malocclusion. Okay, if the tooth material is larger, if the tooth is larger, and then the arch length or size of the arch of the patient is smaller, then it will cause certain malocclusion. So that can be ruled out, or that can be calculated by using caries analysis. Okay, this discrepancy is calculated by using caries analysis, right? So only it is carried out only in the lower arch. Caries analysis is used to calculate only in the lower arch. Okay, So next come what is the procedure of determining the, so in the caries analysis you are determining the arch length and the total tooth material. Okay. So determining the arch length, how you determine the arch length? You can take a piece of the brass wire, measure the arch perimeter by using the brass wire. So as you see in the first diagram, there are three diagrams. In the top diagram, they are starting from the mesial surface of the first permanent molar. Mesial surface of the first permanent molar. The blue line you can able to appreciate, I think. So in the photograph, that is nothing but you can imagine as a brass wire. You can take a brass wire. You can modify it to relate with the arch length, to relate with the arch form of the particular dental model. Okay, you can adapt it, or you can change into to particular size of the arch length. Okay, so you can modify it, and then you can, so from the mesial surface of the first permanent molar on the one side, and then pass over along the buccal cusp tip. Okay, pass over along the buccal cusp tip and along the anterior, as you see in the diagram. Okay, the blue line is crossing now. You have to join all the teeth structure of the premolar, starting from the mesial surface of the molar to the premolar, and then canine, and then anteriors, and then same as along the other side of the tooth structure. Okay, and then continue to the opposite side in the same way till the other side of the permanent molar. So you understand? So this is how you calculate the arch length. Very simple. The procedure is given in a longer way, but it is very simple. Take a brass wire, adapt it to the surface of the tooth, and then just place it on the mesial surface of the permanent molar, one side and the other side. Okay, nothing but that is how you calculate the arch length of the model. Okay, and then, so there are three variations. Okay, there are three variations you can see while calculating the arch length. Okay, so in case of proclined incisor, the brass wire is to be passed along the cingulum of the anterior teeth. Okay, cingulum of the anterior teeth you have to pass on if the dental model is having proclined anteriors. Okay, so one more thing, caries analysis is used to diagnose the lower anterior model, but in the diagram it is given upper anterior model. Don't get confused. For explanation purpose, I have put the upper model. Okay, so caries analysis is used to calculate only the lower model analysis. Okay, so if the anterior teeth is retroclined, the brass wire is passed through the labial surface of the teeth. If it is proclined, it is passed through the cingulum of the anterior teeth. If it is retroclined, it is passed around the labial surface of the teeth. Okay, if the teeth is well aligned, as you see in the third picture. Okay, as you see in the third picture, if the teeth is well aligned, you have to pass the wire. Along over the incisal edges of the anterior teeth. Okay, so these are the three different things you have to keep in mind while doing caries analysis. Okay, then after you finish the measurement. Okay, after you finish the modification, and then after you finish the measurement, you have to take out the wire. And straighten the wire. And then you have to measure from each point of the wire. Okay, total length of the wire you have to measure, and then you have to calculate the arch. Yes, add one. So likewise you have to calculate the arch length of the tooth. or arch length of the model. Okay, so arch length is over. So now you are determining the total tooth material. How to determine the total tooth material? Measure the mesodistal dimension of all the tooth from first molar to the all the anterior, and then add all the values. Nothing but, so they have given as you see in the picture, the size of the tooth, each size of each tooth is being measured by using can be used by measured by using a divider, and then you can calculate the value, and then you can add the value. That is the total tooth material or value of the caries analysis. Okay, and then what you have to do is determine the discrepancy. So you have to calculate the difference between the arch calculated arch length and then calculated tooth material. What is the value you achieve is nothing but the discrepancy value or caries analysis value. Okay, so you get a value by subtracting the arch length and then total tooth material. If the value you achieve is 0 to 2.5 mm, okay, then you have to do proximal stripping for the particular patient. Okay, if the discrepancy is, if the value is 2.5 to 5 mm, then you can extract the second premolar. That is the interpretation, that is the final conclusion we are achieving by using the caries analysis. Okay, if the value is more than 5 mm, then you have to extract the first premolar for the fixed appliance treatment. Okay, so these can be carried out to reduce the total tooth material. So if the tooth material is excess, okay, if the values is coming like this, you have to use certain treatment plan. You have to suggest these kind of treatment: proximal stripping, extraction of second molar, or extraction of first premolar for the particular patient. Okay, so next comes the Ashley-Hose analysis. Okay, the caries analysis is used to determine the arch length and the total tooth material. By using the arch length and total tooth material, the excess amount of the tooth material is calculated by using the caries analysis. Okay, to come into a proper treatment plan. Okay, so next comes the Ashley-Hose analysis. What he do is to rule out the excess tooth material. He determined that arch width rather than arch length is important. Arch width is important rather than arch length. Okay, so then he found a relationship between the total mesodistal width of the tooth from the first molar to first molar and the width of the dental arch in the first premolar region. Okay, that is important for proper treatment plan. So this is one of the analysis. Okay, so for this analysis you need to know the basal arch width. Okay, basal arch width is nothing but the value from the distal aspect of the each permanent first molar, from the one side of the first molar to the other side of the first molar on the palatal region. Okay, so that is nothing but the basal arch width. Okay, so that is also can be calculated by using center point as a tangent. Okay, center perpendicular distance drawn from the first permanent molar. Okay, so that is the basal arch width. Okay, so on the premolar diameter also can be calculated. Arch width is measured from the buccal cusp tip. Okay, the premolar diameter is nothing but the arch width, that is calculated by using the buccal cusp tip of the first premolars on the other sides. Okay, this is, as you seen in the picture, they are using the divider. They are pointing it on the buccal cusp tip of the either side of the first premolar. Okay, so and then you are calculating the premolar basal arch width. Okay, first you have calculated the basal arch width, and then next you are calculating the premolar diameter, next you are calculating the premolar basal arch width. Okay, The premolar basal arch width, how you are calculating, is nothing but it is measured from the canine fossa. Okay, the canine fossa is nothing but there is a canine tooth on the shown in the diagram, and then there is an eminence of the root. The canine eminence root has been shown, canine prominence has been shown. No, next to that or distal to that there is a fossa or there is a depression, that is nothing but the canine fossa. Okay, the canine fossa found distal to the canine eminence. Okay, so you have to on the either side of the canine fossa you have to place a divider, and then you have to calculate the measurement. Okay, that is nothing but the premolar basal arch width. So if you are not able to appreciate the canine fossa or the canine prominence has been not been obvious, it's not, if it is not obvious, then what you can do is you can calculate by using the measurement 8 mm below the distal surface of the canine. This point, the particular in the distal surface of the canine or distal gingival margin. Okay, from that you can measure 8 mm below. That is nothing but the premolar basal arch width. Okay, so now what you have to do is you have to calculate the percentage for each and everything. Okay, so you have to calculate the percentage for premolar diameter to the total tooth material. So that is calculated by premolar diameter into 100 divided by total tooth material. This is little confusing and will not be able to be clear. Okay, you just follow what I am saying. Okay, just observe what I am saying, and then I will explain better in the future classes or in the when I see you in the college. I will explain you better. When you do calculation or when you do a model analysis, you will come to a clear idea or clear point of view. Okay, so next you are calculating the percentage of premolar basal arch width to total tooth material. Okay, that is being calculated by premolar basal arch width into 100 divided by total tooth material. So likewise basal arch width. Okay, basal arch width also is calculated. All the percentages has been calculated. Okay, so after calculating the percentage, you are measuring the three values, right? You are measuring three values: basal arch width, premolar diameter, and then premolar basal arch width. After measuring that, you are deriving a premolar diameter, right? If the premolar diameter is more than premolar basal arch width, that is indicated as you need to expand the arch while doing treatment. Okay, that is indicated for expansion of the premolars. Okay, if the premolar diameter is increased, then the premolar basal premolar basal arch width, it is lesser. If it is lesser, then it is contraindicated for expansion. Very, very simple. If the value is greater, then there is no need for expansion. If the value is lesser, then you need to expand the arch for particular treatment. Okay, expand the arch as well as you can distalize the first molar. Okay, so that is given very simply. Okay, if the percentage is 37, you need to do extraction. If the percentage is 44 or more, then you can treat by non-extraction. If the percentage is 44, extraction may or may not be required. Okay, so these are the things you can, if they ask you in the start notes or if they ask you in the viva, you can answer these questions. Okay, so we have seen how to do model analysis by using arch length. You are seeing arch, you are calculating the arch length and then total tooth material and then width of the arch, width of the premolar, in between the premolars, in between the molars. By using these three things, you are doing certain analysis. Now another analysis, that is nothing but a Bolton's analysis. This is done by using, this is done to calculate the size of the tooth. Okay, the size of the particular tooth is very important for doing the Bolton analysis. Okay, so there is a ratio, the Bolton's, so caries analysis is done by using calculating the tooth material and the arch length of the particular arch. Okay, but in the Bolton's analysis, what he has done, okay, he calculated a ratio between the maxillary and mandibular teeth. So caries and osteo analysis in the same arch, okay, but in the Bolton's analysis they are calculating or comparing the upper and lower arch or maxilla and mandibular arch. Okay, they form a ratio. Okay, so why this Bolton's analysis is important? Okay, why this Bolton analysis is important? Because, so in the first picture you see the arch length is very small. Okay, the teeth is not able to accommodate into the arch. Okay, so while by using the Bolton analysis we can calculate certain thing and then we can add them. So what you can calculate is, you can calculate the excess tooth material of the particular arch. Okay, so there are a lot of excess tooth, okay, or excess tooth material that has been calculated by using the Bolton's analysis. If the maxillomandibular relationship and also the maxillomandibular relationship has to be proper, the maxilla has to have particular amount of tooth material. You have to compare the maxilla and the mandible. The mandible also should have a particular tooth material in relation with the maxilla to achieve proper occlusion or to achieve proper interdigitation. Okay, that is very important. The maxilla has been relied on mandible. I am telling about the tooth material. The mandibular tooth material is relied on maxilla for proper occlusion or proper interdigitation. Okay, so in the second picture there is a smaller maxillary lateral. Okay, there is a smaller maxillary lateral, and also in the left side there is no lateral incisor. Okay, so there is a deficiency of the tooth material in the upper or maxillary teeth. Okay, the lower teeth are proper, so there is a lack of occlusion or there is showing some spacing. So this kind of discrepancy can be calculated by using the Bolton's analysis. Okay, so and then in the third picture you can see there is a smaller lateral incisor on the left side. Okay, so there is a spacing, but the interdigitation is proper. Okay, but in the particular maxillary lateral region alone there is a spacing, so there is a Bolton's discrepancy in the upper and lower arch. So regarding to that, you have to plan your treatment or plan according to the Bolton's discrepancy is very important. Okay, so to calculate the Bolton's discrepancy there are certain values are important, likewise in the caries analysis and Ashley-O's analysis. Okay, the sum of the mandibular 12, nothing but mesiodistal width of all the tooth, nothing but the total tooth material. How you calculate it for caries analysis and Ashley-O's analysis? Total 12 number of tooth has to be calculated and added. Okay, from the second molar on the other side to the other second permanent molar. Okay, likewise in the maxilla, likewise in the mandible you have to calculate, and then you have to calculate the mandibular 6 separately. The canine to canine you have to calculate the tooth material, each and every tooth material you have to calculate from canine to another canine. Okay, and then you have to sum it up. Okay, likewise in the maxilla and mandible 4 values you have to calculate. In the mandible total 12, in the maxilla total 12, mandibular anteriors and then maxillary anterior. Okay, so to calculate the Bolton's discrepancy there is a determination. Overall ratio has been calculated. So mandibular 12 value total tooth material into 100 divided by sum of maxillary 12. Okay, divided by mandibular maxillary 12. That is the formula for calculating the overall ratio. That formula, okay, that value should be 91.3. If the value is 91.3,